So here we are on video number 3 on the Immune Health 101 program that we put together for you. Today's topic is we're going to be speaking about autoimmunity. Now, many watching this probably already know that you are autoimmune. You've probably been given a diagnosis. For example, Hashimoto's hypothyroid, very, very common. But there's a lot of people out there who actually have autoimmunity and they don't know. It's not being diagnosed. Very often, the reason why it's not being diagnosed is the more traditional doctors are not running the tests to confirm it. And historically, the reasons why traditional doctors don't really run the tests to determine if you're autoimmune or not is because it doesn't change their strategy in treatment. Okay? Their treatment is still just symptom-based treatment. Okay? They're not going to treat the reasons why a person develops autoimmunity, so they don't bother running the test. But let me just step back because I didn't really get into explaining about autoimmunity itself. Really, what is autoimmunity? Okay, many of the patients I speak with who have it don't really quite even understand it. They have the condition, and the doctors aren't explaining it to them. So if they don't even understand the condition, how are they supposed to be proactive in trying to mitigate the condition, right? So let's just start. Your immune system, as we said in earlier videos, is your system that is there to protect you against things that are foreign. Your immune system is not designed, it is not supposed to look at self-tissue. Let's use thyroid as an example. It should not look at the thyroid gland and see the thyroid gland like it sees a foreign antigen like a virus or a bacteria and want to mount an attack against it. But that is the very nature of what autoimmunity is. It's your immune system mounting attack against self-tissue. Now, why would it do that? That's the question. Why would it do that? Okay. In the past, it was dialogue that the immune system was confused, it didn't know what it was doing, but that's not true. The immune system is doing exactly what it needs to be doing. What it is that it's seeing things there that shouldn't be there. Right? So if we have, for example, environmental chemicals that are getting into systemic circulation and they are binding to self-tissue, right? That tissue looks different. That tissue looks like a foreign agent. And your immune system will tag it. They tag it with what is called an antibody. Okay? That antibody is a marker like a bullseye sitting there. And it tells another part of your immune system that does the killing. It sees the bullseye, sees the antibody against, in this case, the thyroid gland. And the other part of the immune system that does the killing sees that. And it wants to go after it. Now, the reality is that antibody could be sitting positioned against that thyroid tissue for years, even decades. And the part that does the killing may not go after it right away. It can just be sitting there. So it's just like a ticking time bomb. But somewhere along the line, something happens. Something triggers a response. Okay? Some type of, my experience is with women specifically, it's so common that after a woman gives birth, she will say that ever since I gave birth to this child, my health has been spiraling. That's often, for many women, it's a trigger event that turns on this immune response that goes after the thyroid tissue. Okay? So what is important to understand is that in an autoimmune case, your immune system designed to take care of things against that is foreign is attacking self-tissue. Okay? The best analogy I can give to you is like your thyroid, in this example, is like an innocent victim in a drive-by shooting. Yeah, it needs some attention, it got hit, right? So you got to give it some medication and stuff, right? But if they're still a gang and still driving around the neighborhood, there's going to be collateral damage. Right? So when a person is diagnosed with an autoimmune condition, in this case, it's thyroid, Hashimoto's thyroid. Right? The reality is it's no longer a thyroid game. It now becomes an immune game. And the management for that patient, it has to be immunologically based. Just giving somebody Synthroid or levothyroxine is not changing anything, because the immune system is what is the cause of what's going on here. And if you're not dealing with the immune system, it's going to probably progress and go to other tissues. So the question always is like, well, why is it going after a certain tissue? As I said, if chemicals get into the environment, or heavy metals get into the environment, even pathogens get into the environment, if they bind to cell tissue, that tissue protein looks different. So a small example would be, let's just use mercury as an example. So if the mercury is binding to the thyroid tissue, to the immune system, it looks different. Now the question is the only place in your body, is mercury only gone to the thyroid gland? Or possibly other places too? Other places too. Which is why if you don't treat the condition correctly from an immunological perspective, okay, that these autoimmune conditions are going to progress. Now, as far as the name goes, right, with autoimmunity, it's the name really is just a description as to where the autoimmune is taking place. So if you diagnose a Hashimoto hypothyroid, it's autoimmune against the thyroid gland, right? If it's rheumatoid arthritis, it's against your joints. If it's multiple organs like kidneys, connective tissues, it's lupus. If it goes after the myelin sheath, the cover your nerves, it's multiple sclerosis, right? If it's your colon, it's ulcerative colitis. If it's your pancreas, it's type 1 diabetes. So you see, in our society, in our culture today, in the allopathic model, right, is that if you have a diagnosis of MS, then you go to a neurologist for treatment. If you have rheumatoid arthritis, you see a rheumatologist for treatment. If it's Hashimoto's thyroid, you see an endocrinologist for treatment. So, and the treatment is just basically kind of like steroid immune suppressing drugs. But the reality is, all of them have a common denominator. They're all autoimmunity, and the question is why? What is the immune system going after? Okay, so in our next video, we're going to get a little bit more into how this is turned on, right? How this can be triggered, and some of the steps you want to do to correct that. Okay, we'll see you in the next video.